Okay, hello everybody. It's Friday, November the 12th, and we're joined with, a wonderful group here that we're going to talk about in just a second. My name is CareSource, and our First Lady's with us today. But first, let me address just this, that we've got 18 additional deaths since we've been with you on Wednesday in West Virginia, and I know I don't want to make any way light of the fact that we've lost 18 great West Virginians, and that's tough stuff. It's incredibly tough stuff for all their loved ones. And, to say, well, that's better, it's really difficult for me to say that, but at the same time, it's surely not like, the days when we read 110 names. I want to caution you over and over that cold weather is coming. And this could turn around and bite us, and it could very well snap back the other way. Instead of it looking like it's going to get better, it could snap back and get really tough. I would beg you to get vaccinated. It's the only tool in the toolbox that I've got to combat this. And so with all that, especially, I would beg you to get your booster shot. Because those folks are a lot of the elderly, and they're slow at getting this booster shot. And without that booster shot, really and truly, if you'll just listen to Dr. Marsh when he said over and over, two shots, fully vaccinated, 6 months out, meaning it's been 6 months since your last shot, is of almost no value. Well, for crying out loud, please listen to these people. Please, please, please listen to these people. If you're 65 and older or 50 and older and you get this, it's tough stuff. It's really tough. And you may not make it. And absolutely, all you really need to do to protect yourself is get that booster shot. Get the booster shot and give us a little additional time to be able to find the surefire remedy to stop this thing. But we need you to do that. The 4,593rd death is an 84-year-old male from Kanawha County. The 4,594th death is a 73-year-old male from Raleigh County. The 4,595th death is a 69-year-old female from Berkeley County. The 4,596th death is a 71-year-old male from Raleigh County. The 4,597th death is a 65-year-old male from Nicholas County. The 4,598th death, a 59-year-old male from Wetzel County. The 4,599th death, a 73-year-old female from Monongalia County. This is probably fitting, to tell you the truth. The 4,600th death in West Virginia is a 33-year-old male from Marion County. It's almost like God above is telling us something, is it not? I mean, really and truly. A 33-year-old person we lost in West Virginia. It's terrible. Just terrible. The 4,601st death is a 69-year-old female from Taylor County. The 4,602nd death, a 72-year-old female from Harrison County. The 4,603rd death, an 86-year-old male from Kanawha County. The 4,604th death, a 66-year-old female from Webster County. The 4,605th death, a 47-year-old male from Marion County. The 4,606th death of a 74-year-old female from Kanawha County. The 4,607th death of a 50-year-old male from Cabell County. The 4,608th death, an 89-year-old male from Randolph County. The 4,609th death, a 75-year-old male from Roane County. And the 4,610th death in West Virginia is an 80-year-old female from Cabell County. Just think what I just said to you just a second ago. Now we've lost 4,610 people in West Virginia. The 4,600th death, a 33-year-old male from Marion County. I said, is it not possible that God is telling us something? Well, how I feel about it, and I've told you this before, coincidence. We could say it's really a coincidence that this 4,600th death is a 33-year-old person. Coincidence. Definition: an everyday occurrence in which God chooses to remain anonymous. Just think about that. Active cases, 6,727. New positive cases, 1,138. We tested a lot. Our daily positivity rate, 7.56. Cumulative rate is now 6.15. Over 270,000 have recovered. 529 that are hospitalized. 183 on the ICU units and 91 on ventilators. It's hard to look at that. It's hard to look at it and absolutely think, oh, it's better, it's better. It is somewhat better, but at the end of the day, it's a long ways from being great. Now get this, we have dropped down to 72% of the West Virginians that are hospitalized are unvaccinated. 72% are unvaccinated. What does that tell us? It tells us real simple. 28% of the people that are in the hospitals have been vaccinated. How many of them would you think have not gotten their booster shot? I'll bet you it's a bunch. How many of those that haven't gotten their booster shot that are hospitalized that got vaccinated are sitting there praying, wishing like crazy that they would have gotten their booster shot? Don't be them. Please don't be them. 8 green counties now, that's pretty decent. 37 outbreaks in our school communities in 17 counties, 587 confirmed cases. Now, I promised you just a few minutes ago that we've got some really special people with us, and they've got some announcements in regards to communities and schools. Now, you've heard me say this before about communities and schools. And you know I don't blow smoke at anybody. This is absolutely sincere as I could possibly be. I always try to represent the truth, and I'm going to just do that to my grave. But with all that, I mean it when I say that I'm in schools a lot. You know that. I coach. I'm in and out of schools all the time. And I love it. I love it teetotally to death, because I absolutely gain energy from our kids, and I challenge any government official, any politician and everything, spend time in the schools. Spend time with kids. I mean, spend as much time as you can possibly glean off with our kids. It will absolutely pay incredible dividends. But this communities and schools thing is absolutely off the chart good. I mean, there is nothing that I have ever seen in our school systems and everything that works like communities and schools. Now, with all of that, let me just say just this. I don't want to act like that Kathy had a crystal ball or Jim had a crystal ball and we picked something that was just unbelievable and absolutely ran with it and everything. We just fell off. We just absolutely just happened upon this. We didn't know anything hardly about communities and schools. And then we started, and it got better and better and better and better. We started with a simple thing. I said, well, I'm not going to take my salary and everything. Well, let's put that in communities and schools. And so we start. And in the beginning, we started with 3 counties, Wyoming, McDowell, and Berkeley County. The only county in the state that had communities and schools really going was Greenbrier County. And we knew a little bit about it, but not much at all. Today, we're in 31 counties in 171 schools. We've got 167 dedicated on-premise site coordinators. It's impacting over 70,000 West Virginia students. Our goal is absolutely real simple: get to all 55 counties. And with that, like I said, we've got a great announcement today by an organization that's coming in and wanting to support communities and schools because they believe in what we're doing. But I'll turn it over now to our First Lady. We've got Kathy with us and these great folks from Care Source that are with us today. So it's all yours now.
All righty. Thank you. Thank you, Jim. Hello, everyone. It's great to be here today. We have a really special presentation today from Care Source. They're supporting us with Communities in Schools. Just this week, we were with the founder of Communities in Schools, Mr. Bill Milliken, which was a real pleasure. We got to visit an elementary school, White Sulphur Springs Elementary. It was a wonderful visit. We got to talk to children there, and so it's just thriving and going so well. So I encourage you to be a part of it, and I'll turn this over to our Care Source.
Thank
as
you.
now.
Thank you, I appreciate it. Special Lady Justice, it is with great honor that CareSource is able to make this $25,000 resource towards communities and schools. You know,
Great.
from talking to you, it
Thank you.
it really aligns very closely with the initiatives that we're doing, looking
Mm-hmm.
at more a holistic approach. So sincerely, from the bottom of our hearts, thank you for everything that you're doing.
No, thank you all. We appreciate this, and this will be put to good use, I promise.
Thank
you.
I just want to say we're so happy to be part of this. And what a statement it makes to our kids in West Virginia that our governor and first lady care so much about them and are so involved in this. It will make a big difference for our kids. We know that, and we're happy to be part of it.
Well, thank you, Kathy. Thank you guys so much in every way.
Thank you. This is
And,
wonderful.
you know, it's really meaningful. I mean, really and truly, you know, $25,000 will go a long, long, long ways.
will.
And, you know, to helping real people and helping really, especially helping these kids. You know, I challenge people with this all the time. When you have an opportunity to reach out and touch and impact a child's life and everything, and maybe even their parents or whomever it may be, it really means something. It really, it's why it's what we're supposed to do. I mean, really and true, it's just who we are and what we're supposed to do. And but a lot of times we miss it. We got a lot of folks that are falling through the cracks and really hurting. So we really appreciate y'all. Thank y'all so much.
You.
Well, I've got to go back to some more statistics and everything, and I'll move through this as quickly as I can. But I remind everybody again that 65 and older, especially if you've got any health condition whatsoever, and you feel the least bit funny or anxious or whatever, and got any kind of problem, go get tested. We can absolutely save your life with these antibodies, but we can't do it if it's too late. If you let it go 10 days or something like that and thinking you're going to get better and it's just a cold or it's just a headache or you're just feeling tired and everything, and then all of a sudden it's 10 days into it, 8 days into it, these antibodies will maybe help some, but not much. And really and truly, then you're in for the battle of your life. I encourage you like crazy, if you're that person, 65 and older, and you're going to go into a crowd of people that you don't know, indoors, especially indoors, and everything, think real hard. If you have any lung conditions, diabetes, whatever it may be, wear a mask. And we've been doing lots of stuff with Baby Dog. We're doing round 3 for Baby Dog right now, and these are for children. We've targeted our children ages 5 through 17 with parental consent. In regard to getting them vaccinated and everything, we're going to give away lots and lots and lots of prizes each week. We're going to give away 25 prizes of $10,000 each, and we call them education savings funds. And the neat part about this is you can leave the money, I guess, with the state, and we'll invest it. And then it's in your name and it's your money. And then at some point in time when you go to draw that out, and especially if you were a child that won this and your parents agreed to do all that and set all that stuff up, maybe by the time they got ready to go off to college and everything, that fund may be really, really big. But the price tag's probably going to be really, really big for them to go to school too. We're going to give away 100 every week lifetime hunting and fishing license, and then we're going to have a great big grand prize of the education savings funds for a student. And in addition to that, we're going to have a great big party, a grand party at the end, and probably your governor may end up being, well, he'll be there with Baby Dog, and it'll be really good. Nevertheless, getting back to some statistics, we're at 63.1% of the people in the state of West Virginia that have had one shot that are 5 and older. That's our total eligible population now. We're at 70.6% of the 18 and olders. We're at 85.4% of the 50 and olders. And get this number right here. We're at 96.9% of everybody 65 and older in West Virginia is vaccinated. 96.9%. Now just ask yourself this, please, please, please ask yourself this. If you're 65 and older, and we've got almost 97% of you vaccinated, have you gotten your booster shot? Are you 6 months out? And if you're 6 months out, and you've with Pfizer and Moderna, you have got to get that booster shot. Dr. Marsh would look right at you and say just this: if you're 6 months out and you have not gotten that booster shot, you may be no better off than if you were completely not ever vaccinated. Now, would you really like that? Well, that's where you're at. That's where you're at. You've got to get the booster shot. Now, get this. We have had 1,072,338 West Virginians get the first shot. We have done 48,893, the West Virginians that have, I think that is the correct number, that have received their booster shot. Now, if I'm off in that, I'm not far off in that. The net of the whole thing is we're sitting somewhere around 5% of the population that received their first dose have gotten their booster shot. Now, I don't know exactly what the numbers are and everything, because as we go through the whole deal here and everything, there's a lot of folks out there that really aren't quite 6 months out and all that kind of stuff. But there's still a tremendous amount of you that are 6 months out that need the booster shot. And there's a bunch of 65-year-old plus that need the booster shot. And goodness gracious, how in the world could you play with this? I'll never know. Because if you're 65 and above and you have absolutely gotten along great and you've gotten your vaccines and everything, now to mess around and not get that booster shot, I mean, you're absolutely just teeing yourself up for a long, really, really tough go. And so the good part is we had 8,819 people that got their first dose or got their doses since the last briefing. That's probably the best number I've seen in a little while. So we're going to keep at it. We're going to keep pouring it on as hard as we possibly can to get your shots and everything. And we're making progress, but it's just too slow. If you've lost your card, call DHHR and they'll get you a new one. The vaccine eligibility 5 and above. We encourage the parents and the grandparents to help us get the kids across the finish line. All the vaccine info's up there. The grand families, we still, we keep telling you over and over. Now you've got 19,000 kids that we know. Take advantage of this. Get those kids vaccinated, and please, please take advantage of this $150 voucher that you can get, the school voucher. We tell the renters and the landlords, we've got real live money that we can send your way and everything. If you'll contact us, we've still got probably $150 million in that bucket that can come your way if you'll just call us. And that multiplier effect on those dollars is positive for West Virginia, so that we want that money in our system, and we don't want it just send it back to the federal government, because you know what they'll do with it. Who knows? And I'll probably get in trouble here, so I better quit there. We thank Frutz, we thank Walgreens over and over and over. I remind you about the free testing. It's free, like I said before, and please take advantage. From a standpoint of our long-term care facilities, 38 outbreaks. We have one church outbreak. It's a total of 8 cases. It's in Nicholas County. The church community has done fabulous. We have 58 inmates and 18 staff cases in all of our correctional system. That's really good too. I remind you about taking the flu shots. You can do it with the COVID vaccine, and absolutely you should be doing that. Now, last thing I have to tell you is just this. If you missed our grand opening of Route 35 yesterday, you really missed something. That's just all there is to it. It really, truly was phenomenal. Phenomenal. I mean, that highway, and I told this story when I was there. When I was at Marshall, which was 1,000 years ago, I was skinny and I had brown hair and I had a bird dog that lived in the apartment with me. and I grouse hunted and quail hunted all over the place all the time in this area right here. I would be on Route 35 a lot, and I kept thinking, gosh, this is one dangerous road, really dangerous. And then all of a sudden there was work that began, and then, Lord have mercy, it went on for 53 years. Through the Roads to Prosperity program, we were able to finish it. And finally do something to finish it all the way to the state line. It opens a corridor to come into West Virginia. Absolutely, it opens development, possibilities all across our state. We were joined yesterday by Senator Manchin, Senator Capito, Congresswoman Miller, and a lot of wonderful other dignitaries. Right here, you have a representative from the Frith family, you have a representative from the Lanham family, and you have Scott Burdett. Scott Burdett is standing right between Senator Manchin and myself right there. That gentleman was on the planning council for the first steps towards Route 35. But I can tell you this, it was an incredible day. The only thing that was a little difficult to understand is I didn't more than get out of the car and people started saying, "Where's Baby Dog?" It's "Where's Baby Dog? Baby Dog, Baby Dog," all the time. And she just takes away all my thunder in every way you can take it away almost. And I'm only teasing, really and truly. We had a show choir there, I think from, I think they were from Winfield. I'm not sure, maybe, and a marching band from Winfield. Tell me where the show choir is from, Jordan.
Winfield High School and Point Pleasant High School.
Oh, and the band was from Point Pleasant, is that correct?
That's correct.
Are you sure? I think that's backwards. But nevertheless, we'll clean that up in just one second. But boy, they were good. They were really, really, really good. But the comical thing is there was a gentleman there, I think from D.C., and he was in highways in a big way, and stood up and he was talking and everything. And I never dreamed that he'd be saying this, but he said, I talked to you and congratulate you on all the different stuff you're doing. And he was just, he was just going on. And he said, but my wife absolutely hoped like crazy that I would get my picture taken today with Baby Dog. And I thought, gee, man, Christmas. And everybody just laughed and cheered and everything. And so nevertheless, it was a fabulous day. The good Lord blessed us with incredible beauty and a wonderful day to have it. And what a gift, that we finally finished Route 35 and bring it back, to where now we can get that truck traffic, on a 4-lane highway and maybe cut back on the terrible accidents in a substantial way. And not only that, but we can open that corridor for development. And it was a really, really, really great day. And so if you missed that, you really missed something. And, I saw Dr. Alexander there. And Dr. Alexander was the head of the business school at Marshall University. And I owe him more than you'll ever know. And it was really, he had his hat on was from, that he was in the Korean War and one of our great veterans on a great day. And again, we salute. And we had the opportunity to pass on all the accolades to all the great people, absolutely great people that have served this nation, and we just love the gift that they've given each and every one of us. I say it over and over, and it's just not old stuff, but I think we owe every single thing we have on this planet to those veterans, and also to the active military. So anyway, a great day overall. I loved it teetotally to death. There was a guy there that we got our picture made together and everything, but he was from Ohio. He was a county commissioner from Ohio, and he just thought that it would be very, very meaningful to their state as well. So all that's good, and I think you can watch it on our website. Watch the ceremony on our website if you missed it. So go to that, and again, to CareSource and everything, we really thank y'all for being here. Thank you for the incredible contribution to communities and schools. And we we're just going to keep moving north. I mean, that's all there is to it. I mean, absolutely, with all in me, we are killing it right now in West Virginia, and that's great. But we don't want to stop now. We just want to keep going and everything. So thanks to everybody. Appreciate y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. I want to follow up with what the governor said with a message that we have been trying to broadcast here for the last week or more, both the governor and all of the leadership team. And that is that, although we have gotten through parts of the most recent surge of COVID-19, that we are absolutely not out of the woods yet. And in fact, some of our metrics that we follow, particularly the reproductive value around the state, continues to go up, which isn't good news because that's a value that usually is pretty accurate at predicting more challenge for us. And as we start to look at our population, the governor really very clearly said this, but I want to say it again. We know that even though we have been very aggressive about helping our most vulnerable citizens be fully vaccinated, and that includes our nursing home residents, assisted living residents, certainly our West Virginians, initially over 70 years old, then over 60 years old, and then over 50 years old, get vaccinated very early when vaccines were first available. We know from all of the data that their vaccine protection, their immune protection is absolutely started to go down. And as the governor said, when we start to look at how many people in West Virginia we will need to vaccinate to stop the transmission of this virus, to try to help us turn the pandemic into more of an endemic, meaning the virus doesn't really hurt people in the way that it's doing now. If people get infected with it, it would take 85 to 90% of our population to be fully vaccinated and, where appropriate, boosted and immune capable for us to see that happen. And right now we are far away from that. And we know that more and more of our folks in the hospital are having, we're seeing people that were fully vaccinated. And we're presuming that those are people that did not get the booster because the mismatch between the number of people who are highly susceptible from dying from COVID-19 still, even people that got vaccinated greater than 6 months ago, over 50 years old, is about 550,000 people. The number of people that we are able to count that have been boosted is less than 50,000 people. This mismatch is really, really a problem right now. And it's going to be a greater problem when we start to go inside. In the state of Michigan, they've started to see another surge start as it's gotten colder there and they're back inside. And they're seeing an increased number of people that are fully vaccinated that are now getting sick and ending up in their hospitals. So this is absolutely, as the governor would say, a fire alarm, run to the fire, call to arms, whatever thing makes the most sense. But we very deeply believe that every West Virginian over 18 years old should be getting a booster if you have 6 months from your second dose of Pfizer or Moderna, or 2 months from your dose of Johnson & Johnson. And General Hoyer will go into more detail about that. One other thing that I want to make sure that we're also aware of is that for the first time, a patient has been found to have a mutation in their virus, in their COVID-19 virus, that makes the drug remdesivir, which is an antiviral agent, which we give for people in the hospital, less effective. Now that in of itself is not anything to panic about. But what it's saying is that as long as we're not immune able to stop the virus from replicating, we're not being firewalls to keep the virus from spreading, then the virus will continue to mutate as it's done here. And as the virus mutates, the virus will become more and more fit. So we are absolutely in a race to try to get as many people vaccinated and immune capable to become firewalls as we can in West Virginia to protect lives, to stop the spread of COVID-19, and to help West Virginia get back to the place we all want it to be. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just again, to reinforce what the governor and Dr. Marsh have laid out. Those with a Pfizer vaccine or a Moderna vaccine, fully dosed with two shots, 6 months out from that, and those with Johnson & Johnson, the one dose, 2 months out, based on the information put out by CDC and FDA, most all West Virginians age 18 and above are now eligible for a booster, and we encourage everyone to get a booster. Based on the data that we have, that the governor pointed out, that we now have an additional increase in vaccinated patients in the hospital, and we know that we must get that turned around in order to reduce that number. As Dr. Marsh pointed out, we also know that our transmission rate is now increasing steadily. It is at 0.94%, and it is trending to where it would go and will go above 0.1 during the Thanksgiving holiday. And that would tend to trend through the Christmas holiday. So as the governor, Dr. Marsh, Dr. Amjad, Secretary Crouch, all of us point out, we have got to aggressively go after not just getting the rest of our population vaccinated, but those boosters for West Virginians. We estimate that right now there's probably approximately 700,000 West Virginians who should be eligible for the booster dose. And as the governor pointed out, we are just shy of 50,000. The good news is that we continue to trend up in the 18 plus population in first dose. So West Virginians are going out and seeking that. But again, we provide you this data, particularly related to the transmission rate, because as Dr. Marsh pointed out, this was built by our own people in West Virginia, by West Virginians at West Virginia University. It has been an absolute right-on benchmark for us. So we know when that number goes above 1, we know we are going to see more hospitalizations, more ICU patients, more ventilator patients, and that's going to follow in a lag with more deaths. So we need West Virginia to get on top of that. Our hospitals are going to be exceptionally challenged again during the winter with the normal course of medical issues that they deal with. We do not want to put them underwater. Last thing I would leave you with on a positive note, I've had the opportunity as adjutant, when I was adjutant general, to work with the First Lady and the Future Leaders program that the Guard had incorporated into communities in school. And I've seen firsthand what those programs do for our young people. So congratulations on getting the additional funding, and congratulations on continuing to grow communities in school. It is making an impact for our children. Thank you.
All right, thank you, sir. Dr. Ayn Amjad and Secretary Bill Crouch are both joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking a moment for my question. I have a follow-up for something I asked Dr. Amjad on Wednesday, and I apologize if I asked the question poorly. Please forgive me. But the question involves health departments or private facilities, pharmacies, healthcare clinics, etc., giving out the incorrect doses of either the booster or the first shot for juveniles. And I was wondering, you said that it had been happening across the state, etc., but what I really needed to find out is where has it been happening, specifically the areas and the institutions which gave out the improper doses. How did that happen, and what mitigation has been taken to make sure it doesn't happen again? So could you provide a list of in addition to, of course, the Mercer County Health Department, other health departments or private businesses which administered the vaccine in incorrect doses, how the investigation determines it happened, and what's been done to ensure it doesn't happen again. Thank you very much.
Please.
Sure, Kenny. So well, let me start out by a couple things. So it happens when usually the facility will report the error, of course. So what will happen is the facility will call in our poison control hotline at the state. They'll notify Dr. Sharman there. She's head of that department, and they'll say, well, we've given an incorrect dose, and those get reported to the Vaccine Administration an error hotline number, and those are usually found right away. And for example, with the Moderna dose at the half dose level, so those will get reported into a registry. Patients will get notified. It gets logged in, and then our team at the Bureau for Public Health will then want to make sure the facility, whether it's a health department or anything, will have their policies in place to make sure things will be done in an appropriate manner. Those take sometimes a few days to go into, and then usually those things are rectified rather quickly. Sometimes it's just a minor error at that simple level where, the doses weren't looked at carefully because some things are done rather quickly and things like that. It happens all the time in the sense that there's human error at that level or things like that. Let me put it simply. But it has happened in different counties across the state. One, for example, was Hancock County, and then that was fixed within a few days. We have another county that we're going to look at, and then sometimes even storage and handling is done. Sometimes things are put, not in the refrigerator right away, and those things are fixed rather quickly. But these are not things that are not happening across the country or in other places. We just want to make sure things are done properly and given accurately. It does highlight the fact that we want people across the state to know that we want the vaccines to be given correctly. This can have it in private entities, but on the state level, we are responsible to monitor these things as a quality and assurance level. But anytime a dose is given, it gets reported to a vaccine hotline number. We check that on a daily basis. It gets logged. Patients are notified so they can watch for any adverse reactions. But that's kind of how the process works. I'm not sure if that helps clarify it, Kenny.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for General Hoyer. You mentioned the potential challenges our hospitals will face this winter. Could you talk a little bit about what you have heard from our hospitals lately? What are they doing to prepare for this potential surge, and what are the concerns? Is it, again, mainly going to be staffing related? Thank you.
General, please.
Yes, sir. Thank you, Governor. Charles, there was a call again this morning. There's regular communication between the pandemic leadership team and the hospitals, and we'll continue to work to help them prepare. Staffing, yes, will continue to be an issue as it is across the country. There continues to be significant challenges as we will see again here with Michigan going into a surge. We'll see a big push for more travelers. We'll see additional money being offered to travelers, and that will impact other hospital systems across the country. So a lot of challenges ahead, and we need to understand too that right now, as the numbers the governor pointed out, as we came down off of some level of surge in cases, our hospitalization numbers came down, but they have plateaued at this point, and particularly in the ICU and with ventilator patients. And that puts great challenge on the medical staff in our hospitals. And I think the last thing I would want to reinforce, Charles, is if you don't get vaccinated and you don't get a booster dose and you become one of those patients in the hospital, you not only impact yourself, you impact other people who may have other medical conditions who will then struggle to get medical care.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, everybody. I don't want to sound like an alarmist here, but I'm almost wondering if the surge is already starting. 1,138 new cases since yesterday. That's up 300. Active cases, 6,700. That's up almost 700 since the Monday briefing. Delta variants went up from about 7,000 to 7,800 since the Monday briefing. That's up by 800. And the booster shots have flatlined. When we spoke on Monday, I think it was about 45,500 boosters. Today, it's 48,800. That's a net gain of maybe 300 booster shots in 2 days. So I'm wondering, A, is the surge starting? And do you expect it to get worse in the next 2 weeks as we approach Thanksgiving? And what do you again say to people about getting these booster shots if in fact all of these things are trending upward after having plateaued?
Mark, let me take this, okay? You know, because I'm making myself a lot of notes here as we go, and let me say this. You know, we come on Monday, Wednesday, Friday. I go all over the state, nonstop. And everywhere I'm at, I tell people, you know, all I possibly can. I'm telling it to the media. I'm telling it to everyone there. All I possibly can as far as encouragement to get people vaccinated. We do giveaways. We do baby doll. We do, you know, the broadcasters have been so good, yourself, to step up and try to encourage everyone, get vaccinated, get your booster shot, on and on and on. Mark, I truly don't know what else to do. You know, we're trying every single idea, every single thing we can possibly do. To be just straight up honest, you may have picked up on something here that could very well be the beginning of the surge again. Without any question, as we go indoors at Thanksgiving and we're visiting with folks that are traveling from all across the land, you know, it's unbelievable how many people are forecast to travel, you know, over the Thanksgiving holidays. It's tens and tens and tens of millions of people. And a lot of those people will be coming right through West Virginia. You know, we're telling people straight up on these at these briefings that, and I think it's called R0 or RT level, is it now is at 0.94. We went through that a long, long time ago, and we need so stringently to keep it under 1.0. It's at 0.94 right now. It's climbing. We see it climbing. We know we're getting ready to go to Thanksgiving dinners. We see this thing climbing. The general, everybody says, doctors, everybody says, as it climbs, what's going to happen? More people are going to be hospitalized, and then absolutely we're just going to lag for just a little while, and then the death rates are going to jump because we've lost those folks. Now, absolutely there is nothing today. And Mark, I don't know how to do it. I don't know how to absolutely say it any more impactful than what I'm saying right now. There is nothing that you're doing today, anywhere it may be in this great state, or for this nation, or wherever it may be. But absolutely in West Virginia today, with the sun shining and everything else, there is nothing that you're doing that is as important as getting yourself vaccinated, and absolutely way more important than even that, if you have been vaccinated and you're 6 months out with Pfizer or Moderna, you've got to get your booster shot now. If you're 2 months out with J&J, you've got to get it right now. Today, right today. Not next Monday, today. You have got to look at it just that importantly. Now, you know, think about this. Think. Not very long ago, we didn't have a vaccine. And then all of a sudden, we got a vaccine, and we were vaccinating the nursing homes, and we told our elderly that they probably, I think at that time it was in January, and we said the earliest that you'll be able to get your vaccine, it will be April. And people that were 65 and older were sitting at home or wherever it may be, and they were scared to death. And then all of a sudden, we changed the game rules, didn't we, in West Virginia? We said, no, we're not doing that. We're not doing that in West Virginia. What we're going to do in West Virginia, we're going to change the game rules. And we're going to lead the nation. And we said now, right now, we're going to start vaccinating our people that are 80 and older and then 70 and older. And we had a run on the bank, didn't we? All of a sudden, the 80-year-olds and 70-year-olds were everywhere lined up and everything to get their shots. I'm telling you, Mark, you're right. I hope and pray that it is not that significant. But the hospitals levels have dropped, but they've plateaued, just like what General Hoyer just said. Absolutely, the RT level is going up. We see it. We know Thanksgiving's coming. We know the bad weather's coming. We absolutely see every one of these indicators. You're seeing them too, Mark. 1,100 plus people have tested positive since we were here the last go-round. Now, we could be right at the beginning of even another surge. God forbid. God forbid. But irregardless, if we're right at the beginning or not, if you're that 65-year-old or 50-year-old and everything, we had a run on the bank when we changed the game rules and said we're going to give those people their shots. Instead of waiting until April, we're going to do it right now. We led the nation in West Virginia doing that, and no telling how many lives we saved. We need to run on the bank today. We need to run on the bank right now with people getting their booster shots. Mark, we've given away everything under the sun. We've hauled Baby Dog all around everywhere and let her see everybody, and she's made a lot of people smile. We've brought a lot of awareness to the fact of giving shots. We continue to get people, but Mark, you're right. We absolutely need a run on the bank right now as far as people getting their shots. Now listen, and then I'll quit preaching. You've trusted me, West Virginia. You've really trusted me because I've told you the truth. And absolutely with all in me, I am telling you the truth right now. For all I know on the planet, this is the only thing that I can possibly do to stop this thing. It's the only thing we can do is get vaccinated. It's the only thing we can do to keep a run on the hospitals and overload our hospitals. Get your booster shot. For God's sakes a living, get your booster shot right now. But with all that, you've trusted me. I've told you the truth. In West Virginia, you've done really, really well. Now, I ask you, please continue to trust me. I am telling you right now, this vaccine is almost, it's fail-proof in lots of ways. Absolutely, for those people that are taking the vaccine, if you have a religious feeling or you have a medical situation, we respect, wholly respect. I stood rock solid about our freedoms in this country because it's made us who we are. But with all of that, really and truly, if you're just a little concerned or a little worried and everything, listen to the doctors. Listen to them. This thing is so safe, it's unbelievable. And not getting vaccinated is absolutely not a smart choice right now. We respect your choice, but it is not absolutely what everybody is advising us and telling us how safe these vaccines are and how good these vaccines are. And to not do it is a big, big, big time mistake. We had 8,819 folks that stepped up since Wednesday, and that's good. But you know what we need? We need 88,000 that step up today, not Monday, today. And I'll go on record as saying to God above, there is nothing as important as getting vaccinated if you're not vaccinated today. There is overwhelmingly nothing as important today as you getting your booster shot. This stuff is really infectious, and there's lots of folks in the hospital that are vaccinated now. I bet the overwhelming majority of them have not gotten their booster shot. Okay, that's all I got.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. First, I want to do a follow-up for my brother, Kenny Bass. He wants to know where the errors are occurring and how many have taken place in the question that he has asked. And then I'll do my question, which is Secretary Bill Crouch question. Obviously, there's a database of people who have been vaccinated so far. You can come up with a spare card if you want to. How detailed is that database? Could you conceivably reach back out to these people and say, hey, you need that booster shot, and do a one-on-one, maybe even a robocall or a reverse 911 deal to get a hold of them to make the point that they are not protected? Thank you.
Okay, Dr. Amjad, you got to come back on and address that question point blank. I think there's 3 counties that are involved, but absolutely, we need to absolutely be 1,000% transparent all the time. Address the question, and and then we'll bring Bill Crouch on the on the database stuff. But really and truly, to follow up with a robocall to everybody and everything, we'll do it. Paul, we'll do it because it's a good idea, and we'll try to figure a way to do it. But Dr. Amjad, tell them exactly, where the areas were that we feel like gave the wrong doses, and then tell them, what we're doing about it.
Yes, Governor. So probably about a week and a half, 2 weeks ago, around the Mercer County incident, there were 3 counties that had vaccine errors. So there was Hancock, Braxton, and Mercer County, which around the same time frame had the vaccine errors. Hancock County got evaluated first. Their vaccine, all those vaccines were held in all 3 counties around the same time. Hancock County got evaluated first. Their vaccines were lifted a few days ago. Mercer County got evaluated, I think, on Tuesday. They're still under investigation as far as when the vaccines will be given to the health department there. Braxton County still is on a vaccine hold. Our team can't see them until, I think, Wednesday. But those are the 3 counties as far as that goes. As far as other private businesses, those go through our joint interagency task force as far as that goes. But I think he asked about pharmacies. The federal pharmacies get vaccines through a federal pharmacy program. So we don't necessarily have eyes on those instances. Ours are more through the state program as far as vaccines go. As far as robocalls, that's a good question. We've talked about getting in touch with people who need boosters, but I don't know if Secretary Crouch wants to answer some of those questions.
Yes, thank you, Dr. Amjad. Thank you, Paul. We are talking about that with the JIAF. We've looked at using Everbridge to reverse call or to ping folks through text messages, et cetera. The database is very thorough. It's very good. Part of the problem, and I've talked about this and talked about it recently, is that we have duplicates in there. When folks go for a booster or even for their second shot, and they happen to go to a different location, we end up with the person in there again with maybe their name spelled a little different, et cetera. So our folks have been working hard trying to find ways to eliminate some of the duplications. But in terms of notifying folks and trying to get messaging to them, we had that conversation earlier this week, and we're hoping to do that very soon. So thank you. Thank you, Paul.
Thank you, Paul. Governor, I'll turn it back to you.
Just want to say, and I'm just making notes, but look, y'all know me. You know me like the back of your hand. I don't have anything to hide. I just try to tell everybody the truth when I come in here, and I don't have time blowing smoke at people. I just don't have time for it. There's too many important things that are going on. within this state, and too many good things that are going on that we want to continue to perpetuate. I do appreciate people trying hard, like Secretary Crouch just said, but I don't really care that they try hard. You know, really, I appreciate it, but I want them to achieve. My dad taught me point blank, don't confuse effort with accomplishment. I'd tell Secretary Crouch just this, you find a way. You find a way. I think Paul's got a good idea. You find a way, if we can find a way, with Everbridge or wherever it may be, to absolutely get a robocall out to these people on booster shots, because they absolutely are making a tremendous mistake not getting that booster shot. You know, and we welcome here in this office any and every idea that we can't absolutely sort through 10 million of them, but we welcome ideas, absolutely welcome them, that will help us get more shots in people's arms. You know, I just can't tell you enough. There's no point in me going back through the sermon again, but I can't tell you enough how all the stars are aligning here, and if we don't watch out, it's not going to be good. The RT level's at 9.4 or 0.94. You know, Thanksgiving's on the way. Cold weather's on the way. Absolutely, we know the amount of people that have taken the booster shot are really low in comparison to how many should have taken it. We know in our hospitals that the number of people that are vaccinated are going up. The percentage of people in the hospitals that are vaccinated are going up. And why is that? It is as simple as mud. Because there are probably a bunch of them are not getting their booster shot. When it all boils right down to it, RT level, percentage of booster shots, what's going on in our hospitals, Thanksgiving's coming, cold weather's coming. Absolutely, if you want a catastrophe on your hands, you let the stars continue to line up and don't get those booster shots or don't get yourself vaccinated, and then all of a sudden, we're going to have a run on the hospitals. And when we have a run on the hospitals, then we've got somebody in the waiting room that we can't get into a room or whatever it may be that has a significant problem. Maybe it be a stroke, maybe it be a heart attack, maybe it be some level of bleeding, whatever it may be, a car accident, whatever it may be, and we may not be able to handle it. Gosh almighty, everybody, this is West Virginia. We have done so good. You have trusted me so much, and I appreciate that beyond belief. And I thank you absolutely for it, and I'm honored beyond all your imaginations. But please, please listen to me and go right now, go and get yourself vaccinated. And right now, if you've been vaccinated, get that booster shot more than anything. For crying out loud, it is absolutely just the thing to do. I thank you a bunch, and I love you with all my soul. Let's keep trying. Thank you.